Welcome back to day 2 of the 2023 APPIS Summit. I am Ruth Kuguru, and I lead communications and engagement for Novartis, covering Asia Pacific, Middle East, and Africa. And as I shared yesterday, I'm also a very proud member of the APPIS 2023 Council. And I'm really glad to be opening today's meeting along with one of my fellow council members, Carmen.
So glad to be here with you, Ruth. I'm Carmen Auste, Vice President of Cancer Coalition Philippines and CEO of Cancer Warriors Foundation. I'm also an honorary member of Childhood Cancer International and a member as well of the UICC Global Advocacy Team and pool of master trainers. For the past 25 years, since my son, James, survive a rare type of brain cancer, I have been a patient advocate, believing very strongly that the voices of patients and their families need to be able to shape and drive health policy programs and initiatives. And like Ruth said, I'm very honored to have been part of the journey of APPIS since its beginnings in 2021, to be part of the tremendous growth in all the years despite COVID, and finally now to be part of the Council for APPIS 2023. Ruth and I thank you for joining us in day 2, and I'm still buzzing from all the enriching discussions yesterday. I think it will take a week for it to marinate and really sink in, with an expert panel of speakers, practitioners, and patients focusing on health literacy and health policy shaping. And I think one of the more important takeaways yesterday, Ruth, that you will agree with me, is the emphasis that was put on meaningful conversations, meaningful engagement built on trust. And today we promise you another very engaging, interactive, and hopefully inspiring session. Ruth, over to you.
I agree with you, Carmen. And as you said, 2023 marks the 3rd year of the Alliance and Partnerships for Patient Innovation and Solutions platform, and therefore our 3rd summit. And I'm also really excited about another great lineup of speakers today who are joining us from across the world to share their knowledge and their experience. The APPIS platform is a year-round commitment to engagement, to partnership, and to collaboration. It includes the summit that we've been to kick off for the last 2 days. And then we have the APPIS Innovator Program, and you're going to learn a lot more about that today. We also have the online APPIS Resource Center and APPIS X, which are the roundtables and initiatives that take place in each country, in each country's own language, to really drive impact based on the local environment and the needs in the country. So we hope you will all continue to be part of the APPIS journey, not just today, but for the rest of the year. Carmen, over to you to give us a quick recap of yesterday and maybe get everyone a little bit excited about also what we have in store for today.
All right. First of all, Ruth and I welcome the 1,000 and more patient organizations, healthcare providers, health tech companies, health policy advocates who are joining us today. Yesterday, we spotlighted the power of togetherness and partnerships. We showcased how the best health solutions are discovered when we listen, really listen to patients, and when stakeholders from all across the health ecosystem collaborate and work together to transform healthcare and create better futures, not just for the patients, but for their families as well. And today we are reminded once again that we are all connected and united by our shared commitment to address and resolve issues that impact on patient access, outcomes, and treatment journeys in 3 of the biggest and heavily populated regions of the world: Asia Pacific, the Middle East, and Africa. And yesterday, Ruth, while we already introduced the APPIS and what it stands for, perhaps today, for those who were not here yesterday, you could do a quick recap.
All right, I'm happy to do that. So an APPIS, we say that word a lot, but as we shared yesterday, every single word in APPIS has a special meaning and was put together with clear intent. So A, very quickly, is for alliance, and there are so many different stakeholders that make up the healthcare system. But we are all allies because we have a shared goal, and that is really to improve access for patients and achieve better care, which means better outcomes. The first P in APPIS is for partnership. And it's really about how we're bringing together different stakeholders who have the same goals, but really to build strong partnerships and work together. I shared this yesterday, but when we talk about strong partnerships, it's not just about working together, but it's really also having that long-term view. Because really, to make the impact we need to in healthcare, we need to be at it for the long term so that we can really make a difference. Maybe, Carmen, I hand over to you for the last 3 letters.
All right, Ruth. And the second P is for patients. Patients are at the heart of what we do. They are our why. Because of their lived experiences, we need to recognize that they play an integral role and have important contributions to the healthcare system and all the things that we intend to be able to do. And yesterday, it was emphasized that we need to work with patients and not just for them. So really hand in hand. Through APPIS, we aim to help patients find their voice, amplify their voices, ensuring that these are valued, heard, listened to by stakeholders, so that in the process, their unmet needs and concerns will be met in a timely manner and in a responsive way by the whole healthcare system. Really, the whole concept of whole of government, whole of society, and whole of system. And of course, a very important letter for APPIS because it really wants to be able to stimulate this I and to be able to scale up this I. You all know this I, it's innovation, essentially finding new and better ways of doing things, doing new things. But even while we focus on that and of saying yes to all of these innovations, I think we need to be reminded, Ruth, of what was mentioned earlier by Steve Jobs when he said innovation is not just saying yes, it's also being able to say no to 1,001 ways that may not be relevant and may not be appropriate for our context and our particular settings. And of course, we know that through APPIS already to the Innovator Awards, we are setting off and breaking new grounds in terms of amazing innovations that you will learn more about today. And finally, S is for solutions. And since it's the second day, Ruth and I decided we have a double S, synergistic solutions. The best solutions are those that we work on together because really working together works. And as we know, healthcare right now is quite complex, multidimensional. Our world is best described, they say, by VUCA, volatile, uncertain, chaotic, and filled with anxiety. And therefore, through our actions and solutions, through working together, our voices will be louder, our actions more powerful, and hopefully leading to lasting and more positive changes for our patients and their families. And we hope that at the end of the day, everyone will walk away from this forum with innovative, patient-centric solutions and a commitment to breakthrough actions for better health outcomes and better future for every one of us. So I'm really looking forward and very excited. Ruth, tell us more about today.
No, great overview, Carmen. You know, one key element you'll see during today's session is something that really gives me a lot of energy, which is creativity. Specifically, you're going to hear examples that show how the power of innovation and creativity help shed light and really help prioritize what patients need. But they also help connect the dots in healthcare in a way that has stopping power and gets people attention and therefore can make a difference. As you and I both know, Carmen, there's so many messages and content coming at us, and everything is asking for our attention. And it's never been harder for a message to really cut through. So in order to be heard, we have really to get people's attention. We really have to figure out how we put together content in a way that's creative and will really make a difference so that people can hear it and then really take the action they need. Does that resonate with you, Carmen?
Yes, that is such a good description of the situation we find ourselves in. And oftentimes, as patient leaders and advocates, we need to communicate information that is really complex, and yet we need to transform it into bite-sized chunks of information. So the challenge really is captured in the questions of how do we create stickiness so that they remember it years after or during deliberations? How do we capture both heart and mind? How do we make sure that they understand, accept, and are then able to relate the message accurately to other stakeholders and would-be partners and allies? And finally, of course, how do we spotlight all the great work that we and others in the health ecosystem are doing to reach more, to mobilize support, and to really create impact? And I know Ruth has an interesting story for all of us. Ruth?
Yeah, no, I mean, I think you're right, Carmen. You know, it's not just about sharing facts, but it's about how we share information and the stories that we tell. And that really makes a huge difference. And I shared this example with you when we were talking earlier, but I remember almost 20 years ago, I was working on an effort to help people really understand the risks of having high cholesterol, something that you can't see, you can't hear, you can't feel. And so we were thinking, how do we get people to take this a bit more seriously? So the team I was working with, we came up with the idea of comparing the body to a house and helping people really understand how veins in your body are similar to the pipes running through your house. So say you walk by a very handsome or pretty house, you know, you can imagine large windows, fresh paint, beautifully decorated. And you'd walk through that house and you say, well, this is a beautiful house. I'd love to live here. However, what you wouldn't see was what was behind those walls. And if you looked inside the walls, imagine if you saw corroded, rusted pipes that are blocked and that had been neglected. You would have never known that that was happening based on the outside of that house until those pipes burst. And if that has happened to anyone, you know that when a pipe bursts in your house, it can really destroy a house or a whole floor. And so we use that same idea to apply to the body and having high cholesterol that's going through your veins, you know, and you may exercise, you may eat well, you may look pretty good on the outside, but all the while your veins are silently being blocked or corroded and put under pressure. And if you don't take the time to sort of open up those walls and get a regular heart health checkup, before you know it, something could go very wrong, right? And you're in a cardiovascular crisis that you don't want. And so, Carmen, just imagine this is something that I worked on 20 years ago. And to this day, I still remember that. And it stuck with me. So that's what I wanted to share.
And that's why it's such a good story, because it uses a very simple visualization that everyone can relate to. We all have that at our homes. And then at the same time, it's able to explain all the important aspects for you to be able to want to do something. And you remember it 2 decades later. I mean, you know, that's the kind of messaging that we all need to be able to think about. In our country, as you know, Ruth, our coalition spearheaded the passage of the National Integrated Cancer Control Act, which is our first and only cancer law in the Philippines. And one of the challenges that we had, a major constraint, was the absence of real-world data. And so we decided that the best way to be able to share the impact of how cancer affects not just the patients, but the family, the workplace, the community, was to really bring in and invite patient survivors as well as bereaved families. And so we brought them. In the Philippines, we have 2 legislative houses, the lower house and the upper house. And so we brought them. And for the first time, they said in the history of our legislative houses, 3 floors were full of people, both those that came from our cancer communities, as well as those who have heard that there will be sharings of these individuals. And more importantly, believing, like you said, that stories unlock hearts and minds, and they're so compelling. What happened was, after the individuals that we had invited had shared, the legislators whose lives had been touched by cancer, who lost family members or were going through cancer, also share their own personal stories. And that is why every time we're asked, what is the secret? Because the law for cancer passed in record time, in 18 months. It usually takes us 3 Congresses, which is like 9 years. This passed in that record time. And we believe it because the stories connected people on the ground, cancer patients, family survivors, with the legislators, and they were all then committed to saying, we face a common problem. It's not just the catastrophic costs, it's the lives that we want to have meaning and to have a better and brighter future, because otherwise the poverty reduction efforts of the government was not going to happen, because the catastrophic cause of cancer was pushing people deeper into poverty. So yes, definitely stories are powerful influencers and shapers, Ruth.
No, thank you so much for sharing, Carmen.
And today we are going to be hearing from expert panelists how we can use creativity and innovation to elevate our patient advocacy work and really create a lasting impact, a memorable and meaningful impact on our stakeholders. Over to you, Ruth.
Yeah, I'm looking forward to today. So to help us kick off, I would like to now introduce Javier Boix. Javier is the head of communications and engagement for Novartis in Innovative Medicines International. And he's here to officially kick off day 2 of APPIS 2023. So over to you, Javier.
Thank you, Ruth and Carmen, and hello, everyone. It's a true pleasure to be here and to see so many people joining us from around the region. I believe it's fair to say that one thing that you all share is your passion to create better conditions for patients to access medicine. So my admiration goes to all of you, because I know this is a hard fight, and I'm pleased that from Novartis, we can do everything we can to partner with you in this endeavor. Only last week, I was in Brazil, and I had the opportunity to meet with someone really, really inspiring and impressive, as I'm sure you all are. His name is Tony Daher. He's a father of a Hunter disease patient and the president of the Brazilian Federation of Rare Disease Associations. Most importantly, he's a critical figure to explain the opening of the first ever hospital in Brazil to diagnose and treat rare disease patients. With the creation of this hospital, Tony and his team are reducing to days what took months or years. By engaging with multiple stakeholders in the Brazilian healthcare system, Tony has made the impossible possible, and he won't stop there. I'm not going to bother you with the details of Tony's story, but I wanted to bring it up because he embodies what unites us today, the passion to find creative and innovative solutions to address access barriers for patients. Illness is unfortunately universal. Access is not. Barriers to healthcare in the region are vast and complex and include limited financial resources, poor infrastructure, limited access to essential medicines, and physician unavailability. At Novartis, we discover new innovative medicines, but that's not enough. We also must partner with multiple stakeholders in the system, patients, healthcare professionals, payers, and policymakers to make a true difference. Take breast cancer as an example. While breast cancer is the leading cause of cancer death amongst women, depending on where you live, it can have a disproportionate effect. Studies show that 5-year survival rates are 66% in India and 40% in South Africa, compared to over 90% in countries like the United States. Culturally more conservative countries have also shown to have lower rates of breast cancer screening than average, leading to poorer rates of survival after diagnosis. Eliminating the barriers that stand in the way of patients having access to early presentation, diagnosis, and treatment of breast cancer will require many different stakeholders to partner with one another to act. Being from Spain as I am, I'm passionate about football and started my career as a sports journalist. In football, we all know that winning a game is never about a single player, it's about teamwork. You need 11 players, each with different skills and strengths. The APPIS platform is based on that same theory. If we think about accelerating access to patients as the goal, This is an ambitious ask and not something that can be tackled in a silo or within one area of expertise. To win for patients, we must work together. Different stakeholders across the healthcare ecosystem, each with different perspectives, different expertise, and different ideas, coming together with the same motivation, to win for patients. This is what I believe is so powerful about APPIS. APPIS actually brings together all the necessary players. Today's session is about using creativity and innovation to elevate health advocacy. And as a communicator, this is something I'm very passionate about. Social media and digital health hold huge potential to amplify the voice and experience of the patient. Storytelling is another technique critical to engage stakeholders. Always remember, what people remember is not what you say, but how you make them feel. I would like to share a breast cancer awareness campaign which really inspired me. It was a 2019 partnership between the patient organization One of Nine and a social music initiative called Kuguru with support from Novartis. By leveraging social media, the campaign video reached over 1 million views and saw an increase in conversations and action around early breast cancer screening for women in their 30s in Israel. They did this by rallying 2,000 breast cancer patients, survivors, and advocates to give new meaning to the lyrics of a popular song, converting it to their battle cry of "Don't wait, early detection can save your life." Let's watch the video.
Okay, ladies. Are you ready? Let's do it!
Let's get loud! Let's get loud! Turn the music up to it! Come on, people, let's get loud! Let's get loud! Turn the music up, hear that sound! As the party make it hot, dance floor never stop, whatever bring it loud. Do it loud, do it loud, do it every minute, every day. Take them all away, gotta live, gotta do it loud, do it loud. We gotta do it, we gotta do it.
There certainly is great power in the voices and experiences of patients, and a greater responsibility for all of us in healthcare and society to amplify those voices to drive change. Thank you for coming together and being part of the APPIS community so we can get loud for patients. And thank you, and I hope you enjoy today's session.
Behalf of patients. So now I think it's safe to say we are fully ready to get started with the day 2 of the APPIS Summit. Today's sessions will be focusing on two of our themes. Number 1, digital health and communications, and the second, health policy shaping. We will also officially kick off the APPIS Innovator Program. We'll be hearing from our two winners from 2022, and we'll also be sharing much more information about this year's effort. Just a reminder that today's full agenda is available here on the platform, but also on the APPIS website. So next, to introduce a series of talks on digital health and communications, I'd like to introduce you to one of our council members, Adam Chi. Adam is the chief of the Smart Health Leadership Center at the National University of Singapore. And in today's session, entitled Next Generation Patient Influencer, Adam is going to be talking to us about how we can use social media and digital health tools to connect with patients. So without further ado, I'll hand over to you, Adam.